President-elect Joe Biden is pushing ahead with his White House transition plans. For more on that, let's bring in CBS News senior foreign affairs correspondent and moderator of Face the Nation, Margaret Brennan. Margaret, President-elect Biden's advisors say that they have yet to receive any information from the White House on plans for vaccine distribution. Are you learning anything more about how long this delay might last and how it could impact distribution of the vaccine to the general public?
Well, it's a completely indefinite timeline, and the ascertainment that has to happen to allow for these classified briefings to become regular is what we're all focused on. That's what Ed was talking about there with Emily Murphy and that need to sort of hand over the keys. In terms of the vaccine distribution, it would have to happen, just looking at the timeline, under a Biden administration. We know, though, that there are already systems and wheels put in motion. We've been covering them. We've been talking about them. So the governors of the states who will have to handle a lot of this have been informed. And we do know the Biden transition team is in touch with those governors. So that's a roundabout way of getting your information. But there is information being passed. This is something we will talk about with Dr. Anthony Fauci, head of the NIH, on Sunday on Face the Nation.
Well, Margaret, I also want to talk to you about the president's ongoing legal challenges. The president faced a setback in Georgia after the state certified its election results, showing that President Trump did, in fact, lose to President-elect Biden narrowly. The Trump campaign hasn't really prevailed in recounts or won any substantive cases in the courts. And still, we continue to see the president's legal advisor, Rudy Giuliani, hold these press conferences. What are you learning, Margaret, about the Trump campaign's strategy and where they hope to go from here?
It's not clear that there is a discernible strategy. It's kind of a throw everything at the wall, see what sticks approach. When you're talking about not substantiating some of those allegations made by Rudy Giuliani, that is really, in many ways, a PR strategy. If it were a legal one, they would have to bring those allegations and evidence of them to a judge, to a court, to be able to substantiate claims. You can say whatever you want in a press release or lie to journalists, but you can't really lie in front of a judge as a lawyer without facing consequences. And so you haven't seen that follow through yet. When it comes to what the president appears to be trying to do in terms of bringing in the Michigan state legislators, or as our Nicole Skenga is reporting, potentially the Pennsylvania state legislators as well, this is really unprecedented. It is directly trying to intervene in the mechanics of the election, and it is potentially dangerous in terms of undermining faith in the democratic process itself. That's why you had, as Paula detailed there, the Michigan state legislators also release a statement saying that they would abide by the law, the will of the people, and not try to subvert the election outcome.
So, Margaret, there's so much to talk about. I have to imagine that it's very difficult for you and your team right now to narrow down the topics. What more can we expect to see on this week's Face the Nation?
Well, the staggering infection rate of COVID-19 as we get closer to the holidays is something we have to talk about. We know that at the White House podium yesterday, Dr. Birx, Dr. Fauci, top health officials made an appearance for the first time in weeks and really warned that it is essentially out of control, that the spread is far greater than what they had expected at this point. And therefore, it is more dangerous when you look at the hospitalization rate of about 81,000 people, according to the COVID-19 tracking project, 190,000 new infections in a day. You have a death rate at one point yesterday reaching 2,000 people per day. Even though there are glimmers of hope, like a higher degree of survivability if you get sick in the first place, you can still get really, really sick. And talking about the strain on our hospital systems and our caregivers is something we will talk about on Sunday. We will also try to talk about the long-term effects if you recover from COVID-19 with Dr. Fauci, and we'll look at the realistic timeline for distribution of a vaccine with Dr. Scott Gottlieb, who is a board member at Pfizer and the former FDA commissioner.
Very excited to see you and Dr. Fauci sitting down together. Margaret, thanks.
Thanks.